I say to Kate, hold there and don't let me bring you down, and hold and relax. We could then add more flexion and hold. We could add little bits of rotation if we wanted to and hold, and all of these just looking at.
To take the hamstrings out and test the glute max by itself, we flex the knee to 90 degrees. Again, stabilizing the trunk, make sure the ASIS doesn't come up off the plinth, and ask them to extend up towards the ceiling, and we apply our pressure with a straight elbow over the distal femur. This is a strong muscle group. 5 is a hold against maximal resistance, 4 is moderate resistance, 3 is completion of. We can stabilize at the trunk, make sure the ASIS doesn't lift up off the table. Can you go ahead and lift up again? We apply resistance at just above the ankle for a 5 and a 4. 5 is maximal resistance, 4 is moderate resistance. An alternate test is to apply pressure at the distal thigh. To take the hamstrings out and test the glute
portion of the ilium, and then it runs to the superior portion of the greater trochanter. It's also known as the deltoid of the hip because it does internal rotation, external rotation, and abduction depending what fibers you're looking at. So much like the anterior delt, the middle delt, and the posterior delt, same thing here at the hip. It can help internally rotate, externally rotate, as well as abduct the thigh in various motions. So for the muscle test for this, what we'll do is have the patient lie face up. And then what you're going to do is just flex the hip up just a little bit, even a little less than that. And then my force is going to be down and in, so hold there nice and strong. And what this is doing is primarily checking abduction of the thigh right up top here. So again, you can slowly load in and then slowly come off. So in this position, it's a nice long lever. I can generate a lot of force when I do a muscle test. However, if patient has knee problems, what we can do is go a little bit higher up the leg. So still in that same test position, support down here, and we can still do that same directional challenge of down and in towards the table and relax. For the side posture glute medius muscle test, we're gonna move the limb up in this position, bring it forward just a few degrees. I'm supporting his SI joint with my thigh back here, as well as on front with this hand. Again, we can do the muscle test below the knee here. However, if someone has knee problems or knee pain, we can slide above the knee. And what's really nice about this is we know this muscle inserts into the lateral thigh, and we can generate force with this muscle test, but you can also feel the iliotibial band contract right beneath my thumb, and you can see all across here the tension develop through this muscle test. So it's actually a really good check at the same time to see if there's any problems along that iliotibial tract. In this side lying position, this variation right here where I'm contacting above the knee is a fantastic way to lead to the greater trochanter. Its main actions are going to be abduction of the hip, though it does have a little bit of a role in internal rotation of the thigh. Okay. For the muscle test on this one, what we'll do is have patient lie face up. So with the patient supine, we're going to go through a glute minimus muscle test. It's going to be a very similar position to the medius, except what we're going to do is instead of about 5 degrees, we're going to bring them right up to about 20 degrees, slight internal rotation, and then again, it's still going to be a down and in motion while you're supporting the opposite limb, and then hold there nice and strong, slowly load in, and then slowly come off. For variations on the glute minimus muscle test, if they have knee problems and this test position here is causing them pain, what we can do is just move up the table a little bit with the limb in test position with contact above the hip, support on the opposite side, and then muscle test that way. Again, if you want to reinforce and not have to work so hard, you can pin that elbow right into your hip and then just lean your body weight into the table, and that gets a really good test across that muscle. Okay, come down. To reinforce that elbow and get a lot of your body weight into it, make sure it's pinned right up in to that ASIS so that when I lock my hand into him, I can just lean my hips forward and my pelvis into the table, and I'm virtually working mostly with my lower body, minimal upper body effort for that. For the side lying variation of the glute minimus test, it's going to be very similar to the medius, but there's a few key things we need to do differently. So what we want to do is make sure he's actually rocked back on his ilium a bit. So what we'll do is bring him back, bring this hip forward just a little. Good. You really need to make sure you're supporting the patient in this position. If I step away, he may roll off the table, and that wouldn't be too good. However, moving the limb up into the test position is going to look, again, similar to the glute medius. This is about 5 degrees of hip flexion, but we need to make sure he's forward at about 20 as well as internally rotated. Now we still need to push his limb into the table as well as back towards me. So that's why it's very important to rock him back on his ilium a bit, while I then lean forward, push down and back. Again, while palpating and supporting through the muscle test. If someone has knee issues, we can slide up above the knee joint and do the exact same thing while palpating. Muscles are going to be adduction, and for the muscle test, we're going to bring the leg up to about 20-25 degrees, and we're going to be pulling out while the patient has to then hold there nice and strong and pull back in towards adduction. There could be some various hand contacts here. You could do underhand, you could try overhand. Again, you just need to make sure you're in a good position to generate force. And again, I don't need to use a lot on my upper body. I can just lean back. It's going to be similar line of drive, but slightly different limb position. We're going to just internally rotate a little bit, and then I'm going to be pulling out, and he's going to be resisting that motion. I'm going to stabilize across on the other ankle, and then slowly load in. Check it that way, or I can come up top, check it that way. If there's knee pathology or knee pain with this muscle test, we can just move it up top, stabilize on the other side, go underneath, cup the distal end of the femur, slowly, because then we know it's running right along this line here, right off the pubis to the femur. So if you're doing any deep tissue work there, this is a really good way to get at it. Now for the muscle test on this, we're going to bring the leg up into this position, slight external rotation, and I'm going to get the patient to hold there. I'm going to support across the ASIS, and I'm just going to push down and out, slowly loading into that muscle, and then coming. And for the muscle test here, what we're going to do is bring the patient's limb up into this position, and there's a little bit of coordination with this muscle test because it's sort of two motions in one, and you do have to use your body to your advantage in this case. What I'm going to do is try and pull the heel down and out, as well as pushing the thigh up and in. So it's kind of tough and awkward to get at first, but what he's going to do is hold that position nice and strong, and then I'm slowly going to try and move him out in this direction, okay? So now do that with resistance. Hold there. And then you can see the contraction. Keep your eye on this area here when we do that. Hold there nice and strong. And relax.
I tend to have the feet together so that I can lock them in, and then I'll assist the patient up into a seated position. Arms across the chest, so just going across the chest. I'm going to stabilise the ankles, and I'm going to say to Kate, if you hold there and don't let me push you down, and then I'm just going to use my body weight to create some force and relax. And then I can also do that where I would get her to lean back further, so just lean back a little bit more, hold there, and the same thing, push and relax. Obviously, the more you go back, the harder it's going to be. I think you want a little bit of tension through there so you can actually see whether there's any weakness there. The other thing you can do as well is actually creating a rotation, so creating a little bit of flexion, a little bit of rotation. Hold, getting Kate to hold there and don't let you yourself fall, and then hold there, don't let me push you this way, okay, and then relax, and then you're working more on the obliques, or looking more at the obliques.
Abdominis, we're going to do it in this position, and we're going to try it prone, a couple options. So first, when you do muscle testing this way, we're looking for connectivity, so you're not trying to push down very hard, you're just trying to see if the person can find the muscles. So first we'll do rectus abdominis. So what you're going to do is grab onto the patient's legs. We want to be below 90, but between 75 and 80. Okay, you're going to have them hold that position. Tell them to take a deep breath in and out, and then you're going to do is hold your legs right there. Hold, 1, 2, and relax. That's rectus. Now if you want to get transversus abdominis, now we're going to have them do the same thing. This time pull your belly button into your spine. Breathe in, breathe out, so hold their breath, and maintain that position. Hold. Right internal, the left external. So you're going to bring this leg up. The key to it is give it some support. If you do it the other way, you're going to get more hip flexors. Here we get a little more support. So bring this down, just bring the shoulder up. You just maintain it there. The shoulder's off the table, but my resistance is this hand. So maintain that there, don't only push, hold, and relax. Good. Then we're going to do the side bending component of the abdominals. So we're going to bring this up. Going to hold it there. Again, hold that there, and hold. 2, 3, and relax. Okay, if we want to do the left side, we would come onto the other side of the table. But so you guys can see, I'll do it this way. So again, through here, I'm stabilizing. This shoulder comes up. Hold your leg there, don't only push it. Good, and the same thing on this side. I want to do the obliques, the external obliques on this side as a side bender. Hold it, don't only push.
Muscles that lie just lateral to the spinous processes, and they're pretty much glued to the vertebral bodies and the ribs all the way up and down the spine here. To isolate these muscle groups and do a muscle test, the easiest way in the prone position here would just be have the patient lift their head off the table a little bit, and right away you can see these, especially in the lumbar and thoracic region, start to contract. And then again, head back down. Nice and relaxed right now. I can keep my thumbs over them, lift your head up, and you can feel bilateral comparison in all these different segments here. Good. If you want to do a specific muscle test, we'll get her to lift her shoulders and chest right up. Let's just apply a little bit of support over the sacrum, and then hold there nice and strong as you lean your body weight over top and try and force her chest and shoulders towards the table, and slowly back down for me, just like that. Good. Now for a seated variation, we'll have the patient sit up, face the camera with her legs off the edge of the table, and we'll get the patient to give herself a nice big hug here. This provides you a nice lever to control and move the body with. And then from here, I'm going to try and move you forward, and then don't let me do it, okay? So you're applying a downward force here, and with my backhand, I'm doing a bit of a slide up her spine. So hold there. And again, and again, and then we can do one down low, and again. Good. Let's spin her around so you guys can see exactly what I was doing. So again, we'll get the patient to give herself a big hug. You need to sit facing the opposite direction. Arm comes around, is basically like elbow, locks on top of her elbows, hand on top of shoulder. We're challenging these muscles all up and down her spine here. So I'm going to try and move her down and forward with this hand. And then with this back support hand, we're just kind of taking up the tissue slack in various areas. So I'll slide up here, hold there, and relax off. Come up again, hold, hold,